Good day everyone, I'm Emerlyn G. Hilario and today I will perform lung assessment. For preparation, assemble equipment and supplies such as stethoscope. For efficiency, the nurse usually examines the posterior thorax first, then the anterior thorax. Provide the client privacy in movement, drape the anterior thorax when it is not being examined. Determine client's history of the following, such as the family history illness, including cancer, allergies, and tuberculosis. Lifestyle habits such as smoking and occupational hazards, such as inhaling fumes. Medications being taken, current problems such as swelling, coughs, wheezing, and pain. For the implementation, inspect the shape and symmetry of the thorax from posterior and lateral views. Compare the anteroposterior diameter to the transverse diameter. Inspect the spinal alignment for deformities. Have the client stand from a lateral position. Observe the three normal curvatures, such as the cervical, thoracic, and the lumbar. So, ma'am, can you please stand po? Thank you, ma'am. You may sit po. Now, we're going to proceed on palpating the posterior thorax. For clients who have no respiratory complaints, rapidly assess the temperature and integrity of all chest skin. Thank you, ma'am. Palpate the posterior thorax for respiratory excursion or thoracic expansion. Place the palms of both your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands and any lag in movement. So, ma'am, can you please do the deep breathing po? Okay, ma'am, thank you po. Palpate the thorax for vocal, tactile, prematus, the faintly perceptible vibration felt through the chest wall when the client speaks. Ask the client to speak such as the word blue moon or 1, 2, 3. So, ma'am, can you perform or speak 1, 2, 3 repeatedly? 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, ma'am, thank you po. Percuss the thorax. Percussion penetrates to a depth of 5 to 7 centimeter or 2 to 3 inches. It detects superficial rather than deep lesions. Ask the client to bend the head and fold the arms forward across the chest. Percuss in the intercostal space about 5 centimeter or 2 inches. Interval in a systematic sequence. Compare one side of the lung with other. Percuss the lateral thorax every few inches, starting at the axilla and working down to the atrium. So, ma'am, can you please bend your head po and put a cross arm on your chest po? So, thank you, ma'am. After percussion, we will now move to auscultation. Auscultate the thorax using the flat disc diaphragm of the stethoscope. Use the systematic zigzag procedure used in percussion. Ask the client to take slow deep breaths through the mouth. Listen at each point to the breath sounds during a complete inspiration and expiration. Complete findings at each point with the corresponding point on the opposite side of the thorax. So, ma'am, can you please breathe normally po? I will just try to listen your lung sound po. Okay, ma'am. Thank you po. So, document findings in the client record using forms or checklists supplemented by narrative notes when appropriate. Report deviations from expected or normal findings to the primary care provider. Once again, I'm Emeline G. Hilario, and this is my performance on assessment of thorax and lungs. Thank you, sir, and have a good day.